Hello, my name is Dr. Punekar, and today I'd like to talk about history taking skills for the MRCP PACES examination. Right until 2020, we have had the older version of the PACES examination, which had a dedicated session for history, which was station 2. But now moving into 2021, we do not have a history station dedicated as such, but we do have 2 clinical consultation stations, and both of these stations will have history taking as an essential component of their assessment. Each station, as you will know, will be 20 minutes, which includes history taking, clinical examination, and explanation to the patient. Right, so history taking for the MRCP PACES examination has evolved over the years, and it is absolutely important that as a candidate you use the most scientific and the most modern way of collecting important information from the patient while keeping the patient the center of this exercise. So traditionally we have had things such as the presenting complaint, followed by history of presenting illness, followed by past medical history, followed by drug history, allergies, family history, travel history, personal history, social history, and systems review. While all of these are still very relevant and very important, I'd like to talk to you something which is very important and which keeps the patient at the center of your history taking exercise. Right, so under the Calgary-Cambridge framework, we consider history taking or gathering the information under 4 headlines. The first would be initiating the session. So under initiating the session, you first of all introduce yourself to the patient, shake their hand, ask for their name, establish their identity by getting their date of birth and address, for example. You then move on to establishing the agenda for the consultation, and you negotiate a plan. You take the patient's consent for speaking to them, and then you start with open questions. So all of these can be considered under the headline initiating the session. We then move on to gathering the information. So under this, we move from open questions to closed questions. Later in this video, I will give you examples. In fact, we will do a little role play and give you live examples of how questions can be asked and how we can move from open to closed questions. You also do ICE, which is ideas, concerns, expectations. So you explore the patient's ideas. For example, if the patient has come in with chest pain, what are their ideas about what could be causing this, for example? And what are their concerns? What are they worried about? The patient could be worried about this being a heart attack, for example, a myocardial infarction. And then expectations. What are they expecting from your consultation? What would they like to be, at the end of this? Would they like to have been investigated and treated? Which is true for most patients. So this is under gathering information. So you're moving from open to closed questions. You're using a structure such as ICE to collect information and have the patient's views. And also, and the most important one here, is attentive listening. Okay, from gathering the information, we now move to explanation and planning. And after that, we move to closing the interview. But under explanation and planning, you give chunks of information to the patient. You're explaining to the patient what you found and what your ideas are about what is going on. But you give them chunks, you give them so much of information, and then you wait, you pause so that they can take it in. And then you check understanding. Did you follow that? Did you follow what I've just said to you? Throughout this and throughout the history, you are using pauses. So you're just giving time to the patient to interrupt you, to ask you things. And all along you're avoiding jargon. Do not use complex medical terms that the patient will not understand or will have difficulty understanding. If you must use a complex medical term, please explain what it means. For example, in a patient with chest pain, for example, if I say that I'm going to ask for an angiogram, I will say what it means. I'll say that it is an image of your blood vessels that supply the heart that we take with the help of a dye that we inject either through your wrist or through your groin. So whenever you use a complex medical term, you have to do the explanation. And it is best to avoid using jargon as much as possible. Now, coming to closing the interview, there are certain fundamental landmarks of this part of history. Firstly, you're going to summarize your session. So far, this is what I have obtained from you, this information. You are then going to ask the patient if they have any concerns or anything to mention that you've not asked already. You are then going to negotiate a mutual plan of action. And remember this, you're going to negotiate. This is not a one-way street. So the doctor is not going to dictate their plan to the patient, but we're going to negotiate a plan of action with the patient. For example, I would suggest that you get admitted today so that we can carry out certain blood tests, we can carry out ECGs, we can monitor your heart, and we can get you seen by the cardiologist. Is that okay by you? So you're negotiating with the patient. And then finally is what we call a final safety net. Did I forget to ask you anything? Is there anything else you'd like to add?
Hello.
Hello, my name is Dr. Punekar. I'm your examiner for today's examination.
Yep.
Is that Dr. Chalkine?
Yes, I'm Dr. Chalkine, Dr. Punekar.
Okay, good. What you have today is a clinical consultation scenario that lasts 20 minutes altogether. You have 15 minutes with the patient in which you take history, do a clinical examination, and then answer the patient's concerns and explain to them your plan. Okay?
Okay.
So in today's scenario, we have a 30-year-old patient who has had night sweats for the last 4 weeks. She has been treated with 2 courses of antibiotics by her GP with no effect or minimum effect. Would you like to take history, do relevant examination, and proceed, please?
Yes. Okay.
Thank you.
Thank you, Dr. Punekar. Hello.
Hi.
My name is Dr. Chalkine.
Hi, I'm Philippa. Nice to meet you.
Philippa,
Corey.
Corey, okay.
Yeah.
May I confirm your date of birth, please?
Yeah, it's 6th of May 1990.
Right, okay, it's correct. May I just call you Philippa, is that okay?
Yeah, that's absolutely fine, yeah.
Right, okay. So Philippa, I've seen your GP's letter to us.
Okay.
So it seems like they're worried about you and that's why they asked you to come here.
Yeah.
Yeah, so I think I was going to speak to you today, examine you and do some tests and then we'll come up with a plan today. Is that okay?
Yeah, that sounds good, yeah.
Okay. So Philippa, can you tell me what's happening with you during these past 4 weeks' time?
Yeah, I've just felt really unwell, to be honest, the last few weeks.
Yes.
I'm waking up every night with these night sweats, to the point where the bedclothes are just dripping wet, and I feel hot all the time. I just feel really tired and just not my normal self, really.
Right, I see.
So yeah, I've had some antibiotics from the GP. I think I've had 2 courses now, but it's just not making a difference, really.
Right. It's been 4 weeks now.
Yeah,
quite a long time.
exactly, yeah.
Okay. So apart from those night sweats and feeling unwell and feeling fatigue, yeah, is there any other problem that you're having?
I think I've just never really felt this unwell, to be honest. I've got absolutely no energy. When I'm walking, I'm finding that I'm getting a little bit short of breath, whereas,
Right.
you know, normally I can walk for miles and it's not a problem.
Right.
And I've just got a little bit of pain as well in my tummy.
Right. See. Okay.
Yeah.
Are you feeling breathless even with a bit of walking now?
Yeah, I can still walk, but it's just that I feel more breathless than I would.
Right.
Than
How far
I'm
can you
used to.
walk around without any breathing problem?
It's not stopping me walking. I can still walk for a few miles. It's just that then I feel more short of breath than I would normally.
So okay. So you're mentioning that you're having pain in your tummy. Can you show me where that's?
It's on the left side here. Yeah.
Does it go anywhere else?
No, just there.
Right. Does it stay there all the time, or does it come and go?
It comes and goes a little bit. Yeah, I don't always feel it, but yeah, it's just
Right.
like a dull pain, really.
Dull pain, not very severe or not very
No,
painful.
No.
Okay. Do you have any problem with your bowel or urine?
Bowels are fine. I've noticed that my urine's a little bit darker
Right.
than normal,
Okay.
and I don't know why that is because I'm drinking lots of water.
Right. Okay. Do you have any pain when you wee?
No,
Any frequency of your urine?
no,
No. Any vomiting at all?
no,
No. Okay. Any problem around your private area from any discharges?
no.
No problem at all. Okay. So apart from that, do you have any fever?
Yeah, I've taken my temperature a couple of times and it's been quite high.
Right.
Yeah, I just feel really hot, and like I say, it's these night sweats are just really, you
Yeah, it's
know,
not
getting quite worrying now.
Okay.
Yeah.
So apart from breathing problem that you have got, do you have any cough, any phlegm,
No.
any discharges from your ears, any sore throat?
Sore throat? No.
No. Okay. Any pain in your chest at all?
No.
Right. Any palpitation, feeling heart racing?
No.
Any-
That's fine.
Right. Any dizziness or headache at all?
No, I just feel really tired and lethargic, and I have got no energy, completely washed out.
I see. Okay.
I've
Right.
lost a little bit of weight as well. Well, quite a bit actually.
How much?
I think it's about 5 kilograms now.
In
Um,
5 kilograms in how many period of time?
It's hard to say, but probably over a few weeks. So
That's quite a
yeah,
lot.
yeah.
And what about your appetite?
I think my appetite is a bit reduced.
Mhm.
I am still eating, but maybe not as much. But
Right.
yeah, I just wouldn't have expected to lose that weight.
Right, I see. So you're not expecting to lose weight?
No.
Right. Any medical history that you have, Philippa?
I've got a heart problem.
What kind of problem is it?
I was born with a problem with my aortic valve,
Mm-hmm.
and then I had the valve stretched, and that didn't really work. So a
Right.
few years ago, I had it replaced.
Right, with a metal valve or with a tissue valve?
A metal
A metal
aortic valve, yeah.
Right, I see. So have you been seeing your heart doctor regularly?
Yeah, I see my cardiologist every year, and they have no concerns.
Right,
so,
okay.
yeah.
Any other medical problem?
No,
Any surgery that you have done apart from that?
no,
Okay. Any problem with your menstruation at all?
no.
Okay. Right, okay. Do you take any medications for that, Philippa?
I take warfarin to keep the blood thin.
Yeah. So, and you're monitoring your blood test regularly?
Yeah, I have my INR checked, and
Yeah.
it's always fine. Yeah.
Right, okay, that's good. Any other medications that you're normally taking?
No,
Allergy to medication at all? Any drugs that you take, like any recreational drugs or?
no.
Okay, that's good. Okay. Do you smoke or drink, Philippa?
No, I don't smoke or drink.
Never smoke or drink.
No.
Right, okay, that's good as well. Okay. Have you travelled anywhere recently?
Travel? No. I just went to Portugal last year. That's all.
Okay. Not to Asia, Africa or any other part of the world? No? Okay. What do you do, Philippa?
I work in a call centre
Oh, right, okay. Who do you live with at all?
with my husband.
Right, see.
Yeah.
Okay. So any problem doing your daily activities, doing washing, dressing, cooking, everything?
No, like I say, I feel like just really exhausted and tired, and it's just not like me. I just don't have the energy that I normally have, and
Right.
obviously I'm not sleeping well, so that's a worry as well. So
Right,
yeah,
see,
but
okay. Any family history about having the same problem like you? Having night sweats or having...
no, my dad has a heart problem as well, but I don't know of anybody who's had these
What kind of
symptoms that
heart?
I've got.
Okay. What kind of heart problem that he's got?
A problem with his aortic valve as well.
I see, okay. Right. So Philippa, do you think, do you have any ideas about what's happening now with you?
I'm just getting really worried about it, to be honest, because it's, it's been weeks now and nothing's getting better. I don't know from a medical point of view what's going on, but I just know that I've never felt this unwell.
Yeah, it's quite difficult. Yeah. Is there any specific concerns that you have?
Just that the antibiotics haven't worked, so I don't know what else can be done.
Yeah.
Yeah, I just want to know what's wrong with me.
Right, of course. What do you expect from this consultation today?
Whether you can run some tests and just try and find a diagnosis.
Yeah. Okay. Yeah, that's fine. So I think I know about what's happening here with you, Philippa. So
Okay, good.
but before I explain to you in detail,
Yeah.
I just want to make a bit of summary. Is that okay?
Okay.
So you came in to see us today because you're having 4-week history, having night sweats and drenching, with quite significant weight loss, about 5 kilograms in these past 4 weeks' time,
Yeah.
and having a bit of dark urine, and having a bit of pain around your left upper side of your tummy,
Yeah.
and you're feeling very tired, fatigued, you have got half replaced with a metal a few years ago, and you're checking iron regularly. Yeah?
Yeah,
Is
that's
that
right.
correct?
Yeah.
Okay. Is there anything that you would like to add or anything that you would like to mention?
No, I don't think so. Just want to know what's going on, really.
Yep. Okay, I can explain to you further,
Yeah.
Philippa. I think so. From everything that I have gathered until now, I think you might probably be having an infection, quite deep-seated infection in your body. Yeah, which I think might be having around your heart, around your heart valve.
Okay.
You might be having infections around this area.
Right.
Yeah. So of course we'll need to rule out any other causes for you to be having infections as well. But I think it's the most important cause here that might explain your symptoms. Yeah.
Okay.
So what I think I should do is we should probably be doing some blood tests, ECG to check your heart rhythm,
Right.
and do scannings of your heart as well, and keep you admitted to the hospital to give you IV antibiotic.
Okay. I've already had antibiotics though. Do you think that these will work this time?
Right. Yeah. So you're taking the antibiotic from your GP orally, but now because I think we know what's happening now, we're gonna give you IV antibiotic from your veins.
Okay.
So that will be targeted into your heart valve, into the infection around that area.
Yeah.
So I'm very confident that like if my thinking is right, and if those antibiotics should work for your infection, and you should get better.
Okay. Is it a serious condition?
So infection around the metallic heart valve is potentially quite a serious condition.
Okay.
But we have got an antibiotic that we can treat that condition, so it is treatable.
Yeah. Okay.
Yeah, it just needs like a long course of IV antibiotic.
Okay.
Is that okay?
Yeah. Thank you.
Yeah. Is there any other thing that you would like to mention or any concerns?
No, I think you've covered it. Thank you very much.
Okay. So let us know if you have any more questions, and then we're gonna discuss again. Okay.
Okay.
Yeah. Thank you.
Right, so at the end of the history, Dr. Kine would have examined the patient and then she would have explained. But for the sake of this video, we shorten this to history alone. Okay, so following the station, I'm going to ask Dr. Kine some questions. Dr. Kine, would you like to tell me what your diagnosis might be, please?
I think Philippa is having prostatic infected endocarditis.
Oh, I see. So you think she's got a prosthetic valve endocarditis?
Endocarditis.
Excellent, excellent. Okay, good. If I were to ask you what other differential diagnosis you might consider, what might you say?
I think we should consider about intra-abdominal infection, kind of like
Such as
abscess around the splenic area.
Okay. Is that because yes, she's got pain in that area, hasn't she? Yes.
Yeah.
Okay.
And I also need to think about other systemic causes of infection, deep-seating infection as
Okay.
well.
Anything else?
With the history of weight loss, I think we should probably think about malignant process going on, like lymphoproliferative disorder.
Okay, excellent. That's really good. Okay. Thank you.
Thank you.